We're trying to make sure that people have access to valid information. We're trying to make sure that health workers have access to valid information, all through, harnessing the power of digital tools. One thing to recognize is that there are a lot of great, great opportunities. Digital tools are out there, not because we want them to, but because people are doing it naturally. But we also want to make sure that we're getting the right information, that we're doing it to strive for quality of care, and that it's actually being done to protect individuals as well. People are going to digital tools and platforms for accessing information on health. And specifically as it relates to sexual reproductive health and rights, we know that because of the sensitivities, the taboo, and some of the intimacies around some of the topics, that people will particularly be looking to digital tools to access information. But we know that when information seeking is very nonlinear, we know that people will be looking at informal sources, sources that they trust, people that they have connections with, peer influences. So our role is really trying to make sure that our evidence-based content is able to make it out into the natural ways that people are accessing information. So we know that there are amazing content creators. We know that increasingly individuals curate their information sources from where they trust. And this toolkit will actually help ensure that those individuals that have built that trust can actually also make sure that they have access to validated content, that they're not having to do the research, they know the latest information that they can include. This is just one piece of that broader puzzle, but we are trying to make sure that our information is out there to the people that need it the most, in the ways that they're going to be consuming the information. We know that it's not a one size fits all as well in terms of how individuals curate the information. So we're serving as a bridging intermediary in terms of getting our, scientific, rigorous content, but in a more digestible format. So then those that really know how to communicate with local audiences have that information, at their disposal.